Just pull out some of your favorite ones.
Debbie Lentz didn't have time for cancer.
And I kept saying to my husband, God just has to let me not disrupt everything everybody in my family wants to do. So what ones are we going to put in the album?
She had a wedding to get to,
Jason's 35, and he's the one that just got married.
grandchildren to dote on,
We have 5 little grandgirls, and they're all 6 and under. And it's kind of fun to hear all the laughter again of little ones. This was scaled down.
and an office to run. But abnormal cells growing deep in the body have a way of doing exactly what they want. Debbie realized how little control she had last year, right before Thanksgiving. Debbie, who's religious about getting her annual exam, went in for a routine screening.
Dr. Langen suggested, since we're doing mammograms and colonoscopies and all the fun stuff, that I do a 3D mammogram. And she said insurance may not cover it, so I may have to pay $75 or $100 to have it done, but she really thought it would be a great idea.
Turned out to be a life-saving idea and the best $75 Debbie would ever spend. The 3D mammogram found something Debbie and her doctor, Patty Langen, couldn't feel and didn't expect: a lump in her breast. The news was devastating.
When the scan came back and it was abnormal, you know, it took us both for a loop, because we just really didn't think, you know, that was a risk for her.
I remember that day I walked out to the parking lot and I was going to go back to work, and I sat in my car and I couldn't drive. It was like, I've got cancer. I just couldn't even say the words.
Debbie didn't realize it at the time, but luck and state-of-the-art technology were on her side.
Good morning. How you doing? Good.
Her doctor's passion for providing women with the best care, coupled with the new technology that 3D mammogram offers, caught the cancer before it had time to invade the rest of her body.
Without the 3D, we probably wouldn't have found it this year. We probably would have found it a couple years down the road.
The 3D mammogram takes a 3-dimensional image of the breast. It is still a digital mammogram, but enhanced with 3-dimensional imaging, which allows the doctor to see so much more. Right now, it is recommended for women who are considered high risk for breast cancer and patients with dense breast tissue. Dr. Langen would like to see it open to all women.
It has been a lifesaver. I've had multiple patients who have been found at a much earlier stage than they would have with traditional 2D mammography. Even though digital is great, and I don't want women to think that digital isn't protecting them in some sense, I'm just saying for those women that I have found early cancer in, I've been so thankful that we have the 3D technology here.
Relax your shoulders, breathe.
Allegiant Creighton Health is the only health system in the metro offering this technology. The machines purchased with physician and community dollars, something not lost on Debbie Lentz,
That's when you were watching her to see what her reaction was to the wedding.
who never really thought about all that technology. But cancer changed everything.
The minute somebody tells me they just had a mammogram, I'm like, was it 3D? Call your doctor and tell them you really need to do a 3D, because we're all in that 55 to 60 range, and the cancer I have is postmenopausal, and that is when people are going to be losing their moms and their grandmas. That's a good picture of both of you.
But not this one. Debbie went through 2 surgeries and radiation. Her cancer was treatable. She made it to that wedding and celebrated another holiday with her family. She's on a mission now to educate women about their options. So is Dr. Langen, who wants the community to know we all have a stake in this one.
Biggest focus is on the patient and what's the cost to them. And you never know when it's going to be you or your family member or your good friend or your hairdresser. You just don't know. And so if everybody could give a little, the impact is so much in the life of these patients. And I've seen it firsthand.